Hey everyone, it's Kaziana and welcome back to my channel.
No one else does. Do I like that? It's easy to figure you out. If I can have you now, then easy's what I'm about. I think you might be the wrong person.
And today I'm going to be performing the return demonstration for damp dusting or asepsis. I'm Hannah Cleese Gonzalez Alcorin, a level 1 nursing student of Foundation University. Damp dusting or asepsis includes cleaning, disinfecting, and arranging the patient's environment or the room. Its purpose is to reduce the microorganisms in the patient's environment, to keep the area neat and orderly, and to reduce the risk of transmission of microorganisms between the workers and also to the patient. We should always determine the factors that might influence the patient's environment, such as risk for infection and risk for injuries. First off, we are going to assess the environment, whether we are going to be needing specialized materials for those that are hard to reach places like above the shelf or below the bed. Next, we are to check the presence of objects that should not be dampened, such as electrical appliances. Third, we are to assess the environment also for the presence of hazardous objects such as ceramics or glass. For diagnosis, we also need to determine related factors that might affect the environment, such as the risk for infection and the risk for injury. For planning, we are to determine the equipments and materials we are going to be using for this procedure. Now first, we are going to be needing a basin with water. Second, disposable gloves. And lastly, 2 washcloths. As always, we need to perform hand washing for infection control and then identify and obtain the materials and equipments we are going to use. Now we have the materials: 2 washcloths, gloves, and the basin with water. We're ready. Let's go.
That it's easy to figure you out. If I can have you now.
I have already washed my hands, identified and obtained the needed materials and equipments. Now I'm going to start. Here I have brought a basin with water, the 2 washcloths, and clean gloves. Again, now I'm going to perform hand hygiene. For every procedure, we need to wear clean gloves. Before cleaning, you need to wear clean gloves. This reduces the transmission of microorganisms and ensures that the medication is given to the right person. In cleaning, use treated cloth or dampened cloth. This is to avoid raising the dust. Then clean away from yourself, especially when dusting or scrubbing articles. This is to prevent undue articles from settling down the hair, the face, or the uniform. Do not shake linens, for it will only spread the dirt. Dust particles constitute a means by which bacteria may be transported from one area to another. Clean the least soiled area first and then to the more soiled one. This is to prevent having the clear area soiled by the dirtier one. Wipe from up to down or start from the upper part going down. This is to prevent transferring the dust particles from an area to another. Wipe the surface using long strokes motions. This facilitates ease and for less effort. Clean and put client's unit in order. This contributes to the comfort of the patient and helps raise the patient's morale. But of course, you need to ask for the patient's permission. This is to enhance the patient's participation. Damp dusting or asepsis is expected to make the client's environment clean, neat, and free from microorganisms.